Our next feature takes us to a unique collaboration that brings together researchers, health providers, government scientists, and children's advocates who are targeting commonplace chemicals that threaten healthy brain development.
Among the many visitors to Washington, D.C. on a summer's day, one group is here with an aim to improve the lives of children in the future. Entering the corridors of power, a unique alliance of leading scientists, child advocates and health professionals. This is the Project Tender team. Tender standing for Targeting Environmental Neurodevelopment Risks. In July 2016, Project Tender released a scientific consensus statement as a national call to reduce exposures to toxic chemicals that can contribute to neurodevelopmental disorders in America's children. At a briefing for both House and Senate staff, the Project Tender team had a clear message.
The science is in. The science is clear and sufficient and substantial, and what it shows is that toxic chemicals are increasing American children's risks for neurodevelopmental disorders, including autism, ADHD, and intellectual impairment.
We're talking about the environment every time we're talking about a woman's health during pregnancy. If we tell her to stop smoking, we're worrying about the environment that fetus is exposed to. If we talk with her about her weight gain or blood sugar, again, we're talking about the environment of health. That's no different than the external environment, the other exposures that she might have.
The Project Tender team is hoping that through regulatory action and a more proactive regulatory system, that they can speed up the process of phasing out toxic chemicals that threaten brain development in children.
And that burden of proof right now is such that you have to prove harm before something's removed from the market, instead of having to prove it's safe before we introduce it.
Pediatrician Arthur Lavin has witnessed firsthand the increase among children in autism and ADHD, or attention deficit hyperactivity disorder, along with the struggles that many families face.
The chemicals we're talking about affect what we call higher cortical functions, the ability of the brain to think, to relate to other people. And the intellectual impairment category is a broad spectrum of all the different ways in which our brains can fail to function properly. Noah is a delightful high school girl who I've taken care of since birth as well. And she's had dyslexia and behavioral disorders that have really impaired her ability to make progress in school and have shortened her horizons for future life.
The project was founded by Maureen Swanson from the Learning Disabilities Association of America and Irva Hertz-Bichotto, a professor and epidemiologist from the University of California, Davies.
Our speakers, who were leading OBGYNs and scientists and pediatricians, really helped people understand why this matters. And the crux of the matter is that we can take steps to reduce children's exposures to these chemicals and over time reduce the incidence of neurodevelopmental disorders.
It's time for action. The legislators can play a role, the regulators, regulatory agencies, they can play a role. And we also are going out to businesses and we're going out to health professionals. Different sectors and need to be engaged.
Project Tender is taking a two-pronged approach. First, we are targeting a short list of environmental chemicals to highlight the larger problem of these thousands of chemicals that have not been tested for neurodevelopmental toxicity. The short list consists of lead, organophosphate pesticides, the brominated flame retardants, polybrominated diphenyl ethers, and air pollution. These chemicals were selected because the body of evidence is solid, that children have been harmed, that these are prevalent exposures, widely dispersed either through products that are in our households or through ambient air or water, and that we had confidence that it would be feasible to actually reduce these exposures.
The Tender group names in the consensus statement phthalates as a great illustration of a group of chemicals of emerging concern to brain development, where the science is just mounting.
In addition, we are proposing to address the systemic problems in our current regulatory policies and implementation.
Although the legislative process can be slow, the Project Tender team say many actions would be relatively straightforward.
Actions to ban lead from aviation gas and from any continuing use in industrial paints, from cosmetics, where we could act quickly to get lead out of products. It wouldn't require any new legislation in most cases.
When we take public action, when we rise up together collectively, parents, grandparents, advocates, policymakers, business leaders, industry leaders, we can make a difference, and a progressive difference, not just for today, but for our future generations. But when we don't see it to the end, we will still have this lingering effect and legacy that could go on for decades, which is incomprehensible as far as I'm concerned.
For many of these neurotoxic chemicals, they persist in the environment for a long time. So even after we've achieved some sort of action on them, they still linger in the environment and can pose threats. We'd like to figure out how to shorten that gap between the knowledge and then taking it to action.
The Project Tender team is hoping that initiatives like the one here on Capitol Hill today will lead to fewer instances of autism, ADHD and behavioural problems, and lead to a higher IQ in children. In Washington, D.C., I'm Harry Horton.